Hello, this is our public health project, and we're on older adults in society, understanding the increasing dementia rates and non farm interventions. So, I'm Jacinia.
My name is Elise.
My name is Paola.
And I'm Chris.
Okay, first we have the introduction to the 65 plus elderly population. The 65 plus population is rapidly growing due to longer life expectancy and advances in healthcare. Aging increased the risk of chronic illnesses, cognitive decline, mobility issues, and social isolation. Many seniors face barriers to health access, including financial constraints and transportation challenges. Promoting physical activity, early cognitive screenings, and community support can help reduce dementia risk and improve quality of life. Nurses play a key role in developing targeted interventions to support healthy aging and independence. So while they're vulnerable or age-related cognitive decline and limited autonomy, socioeconomic barriers, and dementia risk. The public health concern is increasing dementia rates and the need for non-farm interventions. And our research question was, does regular physical activity compared to a sedentary lifestyle improve cognitive function, reduce the risk of dementia over 12 months? Oops. Next, the overview of the population and their health needs are age-related challenges, cognitive decline, and physical inactivity. Principles of public health nursing include preventative care, community engagement, and advocacy. Our healthy goals would be to reduce preventable hospitalizations in older adults with dementia, increase physical activity amongst age 65 plus, and improve access to care. So our foundation principles will be health equity, addressing disparities, promoting well-being across life stages, emphasizing lifelong exercise habits, and engaging in leadership and stakeholders. So policy changes for senior wellness programs.
Oh, sweet. Hi, I'm Chris. Okay. So anyway, the question comes up during this is, how do we monitor senior activity? Thank you, Elise. Obviously, we can't spend 24/7 with seniors, and they still have to have their own life. So the first thing is it's our public health surveillance and intervention wheel. And we want to monitor activity levels with wearable devices. There's one called a mini-cog test, and a mini-cog test is actually it's a neurological battery that allows us to track how seniors are progressing with any disorders they have or maintaining it. When it comes to wearable devices, everybody's got an Apple Watch that they don't pay attention to. That same technology is available to track senior activity levels. And when we talk about health teaching and referrals, we have to understand that yes, seniors have lived their whole life, but there's probably still things that they can improve on. So it might be that thing is, you might have been able to, drink 2 liters of Coke a day, but going forward with how we're monitoring you, we want you to cut down to 1 liter of Coke a day. And then with our referrals, it is a pain that so many seniors don't know what's offered to them in a medical environment. So as nurses, and especially going forward with our question, it's what referrals can we make for seniors to help improve their journey to better health? And that comes with also what we have for our role in care management. We are going to be the connecting factor between the senior and our health goal, and that could be working with providers or other services out there. Now, the United States is a broad and vast place with a lot going on and a lot of different people. So we have to ask the question, what are some cultural, behavior, and socioeconomic factors of health with seniors? First thing off the bat, and one that's going to come up a lot here, is culture. Different cultures view aging differently. Some cultures view aging as a burden. They don't want to be old. I mean, look at the West, where a lot of people spend thousands of dollars not to look old because there's this belief that they're not important, okay? When it comes to wellness is not universally defined among different people. Some people like we could say a lot of sedentary Americans, they might say, well, my blood pressure's good, but they haven't really gone on a walk in 6 weeks. Other things, behavior. Physical activity is the most important factor related to health. If you're more active as a senior, you're probably going to have less health problems and live longer. Not yet. Don't worry, we got this, okay? Social connections and familiar bonds have a major impact on health. And what that means is when you come from a family, and this bounces back to culture, when you come from a family unit that honors the aging person and wants to keep them in the family unit and keep them close, that's going to have a profound impact on how well they're going to age. Basically, if you have a lonely, abandoned senior, their health is probably going to decline because there is a marked connection between mental health and physical health. Already touched on sedentary lifestyle. If you have, when this goes into behaviors with aging, if you have a sedentary aging lifestyle, you're probably going to have more health problems. And then socioeconomic factors. We know what this is. America is a big country. We're focused on the dollar, and we have a very vast and put together privatized health system. That being said, a lot of factors of health can be boiled down to socioeconomics, i.e., if you have more money, resources, and wealth in this country, you're going to have better health outcomes. This one really touches on seniors because we have a lot of seniors that are poor, in poverty, homeless, that don't have that. At the same time, you can go to the villages and you'll see seniors that retired with millions of dollars that have vast healthcare connections that a lot of people don't have. And that is me. Up next.
All right. My name is Paola. So, social determinants of health related to the older adult population. So the first one is the homeless population. So the homeless population represents one of the most impactful determinants of health. A lack of stable housing also implies a lack of security. Homeless seniors often have little to no access to health care, and many homeless populations live in unhealthy or dangerous environments. And we also have food insecurity. There's a lack of consistent sources of healthy foods to a major function. It's a major factor in health for the older adult population. Calories are often mistakenly used as the only measure of diet, and many seniors exist off of a diet of ultra-processed foods due to low incomes or availability. They just don't have access to healthy foods. A lack of fresh, healthy foods is a major component in deteriorating national health among the elderly. And then the last factor is discrimination. So the Western culture generally holds that older adults are a burden. Many seniors self-isolate to avoid the effects of ageism against them, and many older adults struggle to find employment or social outlets due to negative connotations about them. Communicable diseases and cognitive decline. So, and the importance of understanding causal relationships. So, we had two different communicable diseases that we spoke about, and those were influenza and pneumonia. Causes of influenza include lack of prevention, high-risk populations, and poverty. Causes of pneumonia include infection, non-infectious causes, and aspiration. There's a large amount of senior citizens in the United States that live in poverty, and many senior citizens are on subsistence levels of income, and unfortunately many of them are homeless without any options for medical care. Poverty has been identified as a major component of preventable health risks in the United States, and people with lower socioeconomic status tend to struggle with disease prevention and health maintenance in general. It's a well-known fact that senior citizens tend to have less physical reserve and a weakened immune system when compared to other portions of the population. In the United States, senior citizens tend to occupy a strange area of medical study where they are some of the most prone to disease and infection, yet have a disproportionate lack of primary prevention. Methods of breaking the chain of infection. The first method is vaccinations, and that's obviously been proved to be very effective. And the second method is hand hygiene and making sure that you're wearing protective equipment like wearing masks.
Hi, my name is Elise. So what we're going to be talking about now is the policy changes in public health interventions. So we have many various different factors. We have it at the local, the state, and the national level. So when it comes to the local level, that's kind of more, what we have around us. And that's a policy that's going to support local adult populations within the community. And we have, emergency response systems, and they are necessary for our older adult population. Of course, they're essential for every single population, the elderly, the young. But, today we're discussing more the elderly, which they're more at a vulnerable risk. And we have to have implementations ready. So systems that we use for the local, adults, sometimes they have chronic conditions that can lead to complications if we don't handle them well or urgently. So we have to make sure that we have collaboration, communication with local authorities, that we're constantly implementing drills so that way we're prepared if there is an emergency situation to come. And when it comes to the state level, we do have to have different sources, and the source that we chose, it's called PACE. So this is the program of all-inclusive care for the elderly, which provides a comprehensive medical and social services. The reason that we chose PACE is because it offers integrated care into the elderly, and also provides safe community for the elderly, which is sometimes really important, especially if they don't have means of communication. And also we want to make sure that we're reducing hospital stay and improving overall quality of life for our elderly. And older adults, they have a lot of challenges already, especially because, the older we get, the harder it is for us to do things, or the more outdated, they are to society. So we have to have specialized disaster responses that overall reduce mortality. We do have a global crisis that affects the elderly, and we can provide an effective aid for them. We also want to make sure that we're including, the elderly once again in our disaster plans. And then we also have public policy for the national level. So we have an act, it's called the Older American Act, and it's a policy fund that has critical services, and it assists the elderly in regarding their health and their independence, which is something that's really important to consider, especially the elderly. They still want to try to remain as independent as they can be. And then we also have the NCOA, which is useful for the elderly 60 and older. And this allows Congress to promote equitable access services, expand healthy virtual aging programs, such as like telemed, and we can address, their various needs like socioeconomic factors, their housing, exercise, their overall health. And then we had also, being prepared, the emergency preparedness, as we discussed earlier. There are different factors. We have it at the local, the state, and the national as well. So for local, that's exactly as like I said earlier. We want to try to have our emergency, rooms and hospitals prepared. So implementing drills and knowing, the plan if there were to have a natural disaster occur. The government can also establish resource allocation to ensure proper staffing. Staffing is something that is heavily discussed in nursing itself, so ensuring that there's proper staffing for any emergencies is a crucial factor. Global health needs for the older adult is heightened, especially in emergency care. Obviously, this is a very vulnerable population, so we have to maintain education and be prepared for this. When it comes to the state level for emergency preparedness, we want to have financial, or be aware of the financial impacts that may occur, as well as have financial funding for them. So we can use the Department of Elder Affairs, and we can also check and confirm availability and effectiveness of various state evacuation routes. And we can stay up to date with this on the news and our local authorities. And we want to establish refuges and shelters that are specifically set aside for the elderly. We want to try to, provide outreach for persons who demonstrate the need for state Medicaid waivers. At the national level, we want to be able to prepare for emergency situations. Senior citizens should be encouraged to align their plans with the recommendations of FEMA. FEMA provides basically information for the elderly on what they should have, such as like make sure you have packed batteries, water bottles, how to prepare for a natural disaster or emergency preparing. They have resources such as emergency kits, making sure that they're aware of this. They can provide once again or look up through the CDC or FEMA. And it's just important for us to have a key takeaway that political members are also identified as aides or detractors to the struggle to maintain federal emergency funding for our senior citizens. Then we're going to go ahead and go into the health literacy and education, so the needs for our elderly. Health literacy and education is a crucial factor needed in the elderly population. We always want to make sure that us as nurses are educating our patients. That's something that's very important. So we can do this in various ways. Obviously, us as healthcare providers and working in healthcare, our goal is always to educate our patients, to ensure that they're understanding the literacy. So, having that open therapeutic communication with our patients, ensuring that they're understanding what they're telling them, so they can, we can rehearse this by having them read back to us or tell us what we just told them to ensure that they're understanding properly. We can also have community partnerships such as gyms or the local senior centers that can also educate the elderly, not only in regards to health, but making sure that they're up to date with vaccinations and anything that they may need. Methods that we can do to improve this is providing hands-on demonstration to perform safe exercises, but also overall just safety in general for our elderly. And we can also have a development of easy to follow instructions that gets mainly to the point of what they need to know that, okay, I'm understanding this, and proceed with that. And then lastly, we have our reflection. So for me, the biggest takeaway I've had throughout this course is the importance of educating the elderly as well as advocating for them. A lot of times people can discriminate towards the elderly, they'll assume, oh, this person can't hear, this person doesn't understand because they're elderly, but it is our job, especially as nurses, to advocate for them, to make sure that the patients feel heard and feel seen, that they feel safe to talk to us about any problems. So this course has definitely changed my insight in how I tend to care and talk to my future patients.
So my biggest takeaway I've had in this class is that the elderly population is a very specific population that has its own risk factors and complications compared to other different populations. And education, kind of like how Elise was saying, is of the utmost importance to make sure that they're educated on, prevention, how they can prevent falls, and how they can manage their health conditions. Also providing resources to these individuals to make sure that we keep them safe.
Hi, I'm Chris, and I've learned that seniors require various resources for their care. My biggest takeaway is that when we have senior citizens, we need to understand that we need to match them to the best possible care. And going forward in my nursing career, I'm going to make sure that I do that, and that I'm always advocating for senior citizens and providing culturally diverse care.
Okay, so this project has deepened our understanding of public health advocacy, prevention, and intervention. And it's important that we do early detection and proactive care. And my two biggest takeaways is promoting preventative care and enhancing patient education. And
thank you.
That is all.